Hey there, it's been so long since I've done an update, mostly because there hasn't been a lot to update you guys on until recently. I am now 2 weeks post-op of my reconstruction surgery. So yeah, I know I had promised that I would share more about that, and so I felt like I better get on here and share what it was that I did and kind of a little bit about the experience. So what I chose to do for my reconstruction was called a DIEP flap reconstruction. That's DIEP flap. So that stands for deep inferior epigastric perforator. So that's referring to the blood vessels that run through the muscle in your abdomen, and they supply the blood to the skin. So basically what they do is they remove tissue fat that most of us ladies have in our lower abdomen. And when I'm talking about this, I'm talking about from the belly button down to kind of where you would have a C-section scar. So that area. So they basically, it kind of looks like a football shape. They cut all of the fat as well as skin out of that area, and they use that tissue to fill in the area that has been reserved for that tissue in the breast and create the most natural breast that I can now have. Since all of my breast tissue, ducts, all of that has been taken previously, I had those tissue expanders in there, which is basically plastic with saline inserted into it to hold a space for this tissue eventually. So I still had my own skin and all of that. So my DIEP flap is essentially they reopened under the breast where my other scar was, and they put that tissue within that holding space, and then there's like a strip of skin that they transferred from my abdomen. That is to get blood supply through all those blood vessels so that tissue can live. They also use an artery to obviously supply blood flow. So it's a huge surgery. Typically takes between 6 and 8 hours. Mine went about 8 hours. I did have a complication during my surgery. The artery that they were using had a blood clot in it. So they tried to resolve that. Thought that they had everything good, closed me up, put me in recovery, and then there was an issue with one of the flaps. It was not going to be successful, so they took me back in, opened me back up, and there was another blood clot there, so they had to get a little bit more aggressive with it and get that figured out so that flap would live. So that took about a couple more hours. So all in all, I was in surgery for about 10 hours, which is, pretty intense. So the stomach area, it's almost like a tummy tuck. That's such a sensitive subject because a lot of the people that go through this, there's sometimes some insensitive comments like, oh, you're so lucky that you got, new boobs and a tummy tuck out of this. And it's like, while I feel very fortunate that this is an option and I'm not like overly sensitive about it, in fact, I'm like, this is a silver lining that I kind of got rid of that abdominal tissue that I haven't liked for years. It's like, it's kind of a price to pay, the journey that I've been on, and women that go through cancer, it's kind of, it's just a touchy subject. But anyway, they basically do like a football shape to cut out that tissue from, like I said, the belly button down. And then they'll take that skin and pull it down. So you're pulled very tight at the end. So I do have a flat stomach now. I have a ton of swelling, so I don't know what it's gonna exactly look like at the end of the day, but I can tell you that I've never had a stomach that's as flat as it is right now, down low. So I hope that I love the results. We'll see. But right now I'm hoping for the best, and I think I look pretty good considering like what my body's had to go through and like what an insane surgery this is. It's just absolutely wild what they can do with medicine, and I am so thankful that this is something that can be done. Just right away, like my chest feels like my own again. It doesn't feel like I've got a foreign body in there. And I mean, that's one of the reasons that I also didn't really love the idea for me on getting implants. I also have like some concerns with like autoimmune stuff with my body, and I didn't want to deal with like possible sickness from that or just like challenges that might come. So while this is like a much bigger surgery up front than like getting implants placed, once I'm done, I'm pretty much done. Like I don't have to have the implants replaced. There's not a ton more, and they'll just age naturally as I age as well, which means, you know, as we get older, they get more saggy. And you know what? Whenever I'm 70 and 80 years old, I probably want my boobs to look like that instead of being perky and like they're a 20-year-old. So that's just me, that I'm just more like of an all natural kind of gal. But to each their own. Like that's the beauty of this, is that we do have options, and like I said, I'm so thankful for that. So anyway, I was in the hospital for 2 days. They take this surgery very seriously. So the first day and a half, they were monitoring my flaps, so basically my breasts. Once every hour, they would come in with like a Doppler, like what you would listen to a baby's heartbeat with, and listen for blood flow in my breasts to make sure that the blood flow was happening in the transferred tissue, which is, again, wild. And just check it for color. Like that's part of the reason that they put that skin there, is because that skin is like attached to, like that's the lifeline for that tissue. So if anything starts to happen with that skin, they know that something's not right. So they're very closely monitoring all of that. Once I got home, I went home with 4 drains. I had one on each side of my chest and then one on each side of my abdomen. And then I also had a wound vac that was across the scar on my abdomen. So I was carrying around about 10 pounds of just equipment, from the wound vac to the drains and all of that. It was a lot. But I cannot tell you how I'm just absolutely in disbelief of how much the place that I went has pain management on lock. Like I had discomfort and some pain. Mostly the pain that I had is where my surgeon like really tightened up my muscles in my abdomen. He does that for when we get ready to do the second phase, which is more of like the aesthetic phase, to make everything look nice and put back together. But that was like the primary thing that hurt. Like if I coughed, oh no, that was like terrifying, like panic mode. It hurt so bad. And then like one of the times I coughed so hard that I felt a suture like burst in there and I freaked out. So coughing was like off the table, but yeah, they just are amazing with managing pain and dealing with all of that. I think I may have mentioned in one of my previous videos that I couldn't get into Mayo for a year to do this surgery. And so I started a journey of researching other physicians anywhere in the country. And there are so many great surgeons. Two places that I looked at and did consultations with only specialize in this surgery. So they only work with patients, and their physicians and surgeons only do DIEP flap surgeries. So it came down to actually one of those, and I chose a physician in San Antonio named Dr. Gassman, and he is an artist. He's amazing. I cannot wait to see what he does in the next round and how I turn out. I'm so blown away by how good I already look. And I'm only 2 weeks out, and like I said, swollen and kind of got a Frankenstein body going on here, but it's mind-blowing what he's done. So I told him I wanted to look snatched, and he understood the assignment. So yeah. So anyway, I got all of my drains pulled except for one before I went home, as well as the wound vac. Flew home last Friday, and it was easy peasy, and just been recovering ever since. I'm doing so well that it's a little bit harder for me to stay down, I feel like, but I'm good. I'm doing great, and I just really appreciate everyone's thoughts and prayers and you know, checking in on me. So I'll let you know whenever I have something else big that's happening.